maybe we hear from our first consumer, which is Lance from Malaysia.
I'm 53 years old. As a Malaysian woman, hearing from my doctor that I have high blood sugar levels and could develop type 2 diabetes was a real wake-up call. I know some family and friends who have type 2 diabetes, so I understand how serious this can be. I'm now working with a dietitian to create meal plans that help me avoid high sugar food and focus on healthier options. Maintaining a healthy weight is also priority for me. So I'm making an effort to be more active and mindful of what I eat. It's a big change, but I know it's necessary to protect my health and prevent this from becoming a bigger issue.
So Aoife, can you go into a little bit more detail about the impacts and effects of diabetes and also some of the things to watch out for as people, the early indicators of diabetes?
Sure. So look, type 2 diabetes is known as the lifestyle version of diabetes. It can happen when you are, I suppose, slightly overweight, or if you have a really unhealthy diet, so a diet high in saturated fats, refined carbohydrates, sugars. And when you develop high blood sugar levels in pre-diabetes, that leads you to develop type 2 diabetes, and that can then have impacts on your life, such as needing to manage your blood sugar levels, so checking your blood sugar levels, watching what you're eating, because if you cannot manage those blood sugar levels, you will damage your nerve endings. So anywhere that has small nerve endings like your eyes, your fingertips, your extremities, your kidneys, they can all be damaged by the high blood glucose circulating. You hear of people getting amputations, losing eyesight. There's lots of negative impacts. So really it's quite a dangerous disease to develop. And it can really be managed by lifestyle changes, so physical activity, maintaining a healthy diet. So really, they're the main things to consider when you're thinking about type 2 diabetes from a nutrition point of view.
Thanks, Aoife. And Ange, like we talked about, you're looking 5 to 20 years in the future, right? And we've been eating sugar since the 1600s, right? What do you see as sugar consumption looking like in the future?
So I wish I could give you a simple answer, a yes or no, but actually it's quite a complex thing. Because sugar as an ingredient is a singular ingredient, but it works in a system, right? So on one hand, we do have our biological need for sugar. It's very much primate in us. So we're always going to seek out sugar as a reward. And then on the other hand, we have the governments who are playing kind of a very strong role in terms of reducing our sugar. But what I think is more interesting to see and to view sugar as is to take it out of its ingredient system and put it into the reward system. So how do human beings get rewarded? And why is sugar playing such a massive role in that system? What we're seeing right now is actually there's another reward channel that is actually, consumers actually want more than sugar, and that is in texture. Right? Because the textural aspect of food is giving them a higher kind of pleasure feeling than sugar on its own. So what you'll see now is because we have an entryway in sugar, you'll start to see sugar treats have a lot more texture to them, a lot more crunch, a lot more multisensorial within our kind of internal stereo system. So I think when we start to see sugar in that aspect, then the answer isn't so clear. It's actually how do we play with other things in the reward system to deliver pleasure to the consumer.
Awesome. And I know we had conversations before around consumers wanting that noise in their head, like almost like that extra crunch, that extra kind of textural piece is something that definitely people will want to see in the future, right?
The sound system in our head connected to our mouth is it's perfectly designed. So anything we eat in our mouth actually has such an incredible impact onto our body. In the same, and I think it's not very studied yet, but at the same time, we know that when we crunch on a burger or we crunch on a French fry, it gives us that audio and textural pleasure as well.
I mean, I think it's been studied by marketers because judging by sort of fast food advertising over the past 3 years, everything now is like the most satisfying possible crunch in every single ad. So, yeah, totally.
Yeah. The intrinsic value of the food, right, is in the experience of eating it.
So is it about then dialing up that sensorial piece and while reducing sugar to maintain the...
I mean, the problem is you can do both, right?
Yeah. And I think it's a balance, right? Because you have even kind of the outside packaging that can deliver a little bit pressure. So if you look at it as a system and you start to say, okay, if I can't deliver that much sugar because of regulation or because of health concerns from the consumer, then what can I dial up on the other side in that experience factor to compensate for it? But the truth is, I think, if I put myself in 30 years ahead, there's going to be another headline that says we're eating too much sugar. It's just because it's our biological need, right? We're not going to understand why we crave it in an intellectual way, but the physical body need for sugar will always be there.
Can I ask, from a sort of health and nutrition perspective, do things like sugar alternatives like stevia, et cetera, give you the same dopamine delivery as sugar itself? Do you know? Or
I'm not sure if about from a dopamine perspective, but like, yeah, they do. They say that if you're taking, say, low-calorie, sugar-sweetened beverages, it kind of tells your body that it's receiving sugar. So your body's kind of ready for it. So some of your metabolism is getting ready to metabolize sugar.
Yeah,
so
right.
your body's kind of aware of it. But I'm not sure about the dopamine levels, yeah.
Yeah, because like from my understanding, and you might be able to speak to this better than I can, but like our addiction to sugar is primarily just dopamine receptors going wild because our body's receiving energy in very easy, accessible formats, right? So I'm just wondering if you could you dial up crunch and then you pare back the sugar, but you still give the dopamine by using sugar alternatives. If you end up in something that's, similar to that advertisement crunch and pleasure system.
Yeah, and I think to that point, it's also kind of, why do we need so much dopamine at the moment, right? We're getting a different dopamine delivery system from our mobile phones. And that's it's not part of the food system, but it's still impacting the human body as a system. And so I think when we think about our taste buds, did we always think this is the right level of sugar? Right, 20 years ago, definitely the sugar levels were low, but some people also said some things were too sweet then. So we have this calibration that's happening on a time scale with sugar. And right now, we're probably at the peak. And could we calibrate that downwards progressively? Because like every addiction, you need a plan of intervention. and then I think it's historical, but we do have some evidence to show that our palates will change and adjust to the levels of sugar that are more healthy for us.
So all of you talked about sugar replacement. So I guess my question for you, chef background in restaurants, what are some of the ingredients and things that you can do to reduce sugar, replace it, and what kind of in that space?
There's sort of two elements. I think from my perspective, in two areas, people are expecting a little bit less sugar than maybe they were even 5 years ago. And so this is particular to cocktails and desserts. We've seen like this massive surge of savoriness in cocktails, and a similar format. Some people still love really sweet, cloying desserts, but largely the population has shifted towards more savory elementation in desserts as well. The thing about sugar is it's really nefarious, and it can make its way into very savory concoctions as well in pretty significant quantities. Even things like lemons hold like just wild amounts of sugar, and you never get that sensation. But if you take like miracle berries, the ones so they stop you from tasting sourness, eating a lemon is just like eating a piece of candy. And so if the acidity is gone from your mouth, there's as much sugar in a lemon as there is in like a mango. So it's a very sneaky ingredient in that it can play a supporting role in a lot of dishes, and even in a lot of very good restaurants. There's quite a large amount of sugar in savory dishes. What we've done in our restaurants, so like in Penang, we have no white sugar in the restaurant. We limit any sort of like refined brown sugar, and we try and use naturally sourced sugars. That's actually not as related to health as it is to community and having a taste profile for certain sugars. I think white sugar kind of sucks. It just doesn't have the roundness and the mouth-filling sensation. There are sort of stevia-like alternatives. We grow stevia at the farm and in the backyard in Penang. That works, but really, it's still a testing ground for how to deliver it to people in an effective format without refinement. So yeah, there's alternatives out there. I don't know to what extent they're very effective in terms of mitigating addiction to sugar. I think it's just sort of having your addiction in a slightly healthier fashion at the moment. But I am certainly seeing in cocktails and in desserts like a drop in overall sugar content. Yeah.
Okay. I think across the industry-wise, we're seeing people taking less sugar in beverage by choice, and the work being done by Singapore and Malaysia government to try and reduce sugar is also helping in that space.